In this last video on the spleen, we are going to talk about these focal splenic lesions here. Mainly things like splenic infarcts, which can lead to splenic abscesses, splenic cysts, splenic rupture, splenic artery aneurysms, and metastases to the spleen. So splenic infarcts can be caused by lots of different things. For example, you can get a thrombosis in the splenic artery, leading to an infarct. With endocarditis, you could throw septic emboli to the spleen. Or for that matter, you could throw normal emboli to the spleen in various other disease states. And other clotting states can also be problematic, like Anti-Phospholipid Syndrome, HIT, and various other cancers. Now the problem is that if you were to anticoagulate, you run the risk of causing rupture of the spleen with Anti-Phospholipid Syndrome. And we also typically don't anticoagulate patients with sickle cell disease. Now, a splenic infarct can also lead to a splenic abscess, but there are multiple other causes. And we also may have hematogenous spread of endocarditis and even pneumonia that goes to the spleen, or even from GI sources like a GI perf, and even fungal causes. And as expected, patients will present with fever, left upper quadrant pain, and referred pain to the left shoulder. And because it's going to irritate the diaphragm, hiccups. And treatment will include broad-spectrum antibiotics, CT-guided aspiration, and even splenectomy, both of which can lead to bleeding complications. Splenic cysts can be due to a bunch of different causes, including post-traumatic, congenital cysts. You can have them from polycystic kidney disease. They could be epidermoid and hyatid cysts, and also parasites. And now let's move on to splenic rupture, and one of the main causes of this is blunt trauma, and it may be the only damaged organ. And there are a number of other non-traumatic causes as well. And these include things like neoplasms, especially the leukemias and the lymphomas, infections like EBV, like that's the one that we're always taught about, inflammatory diseases like pancreatitis, drugs like the granulocyte colony stimulating factor, and you can see anticoagulants, TPA, etc., even in pregnancy, and there are idiopathic causes as well. Consequences of splenic rupture is the spillage of splenic tissue into other areas in what's called splenosis, which is really spilled ectopic spleen tissue. And the treatment for this is really just symptomatic. And the diagnosis of splenic rupture is best done via ultrasound, but you could also use CT or DPL. And the treatment for this is frequently splenectomy. Now let's talk about the splenic artery aneurysms, which are actually the third most common type of aneurysm within the abdomen. Not to say that this is a common thing to happen, but it's just the third most common one in the abdomen. And it happens frequently in pregnancy. And so usually the first thing that happens is when it bleeds, it kind of bleeds within the capsule. And then after that, it spills out into the peritoneum. It itself carries a high mortality. And treatment really depends on where you catch it. If it hasn't ruptured yet, then you can coil it or place a stent. Now, if it has ruptured, then you need to do a splenectomy. And finally, let's talk about the metastases to the spleen, particularly the non-hematologic cancers. And I listed the common primary cancers: breast, lung, ovary, stomach, prostate, melanoma. And biopsies are rarely done due to the bleeding risk, though a fine needle aspiration may be possible. And this is the overview, the end of the overview of our look at the spleen. And this was a video on splenic lesions. So if you have any questions, please let me know or put them in the comments below. Thank you. Bye-bye.